World Cancer Day, which is going to also run for the next 3 years, is very interesting. It talks about being united, but also being unique, you know. And when you say we're united, the main focus of our unity is to eliminate cancer as much as possible from the human race. And our uniqueness also reflects the differences at individual and country levels. So because it has been established over the years that when you are able to pinpoint and target cancer cells using precision medicine, the side effects are less, the outcome is better, the prognosis is brighter, and as a result of that, this year's World Cancer Day is trying to emphasize the need for us to patient-centric approach to management of cancer, to ensure that patients are at the center, are at the middle of our approach, so that the uniqueness in each individual is taken into cognizance in addressing the issue of cancer in our society.
All right, expanding access to precision medicine, especially in low-income regions, how does this apply to Nigeria?
Well, I must say that Nigeria is just coming up with respect to precision medicine, but we are not lacking too behind. As an example, in our management of breast cancer, precision medicine is being used through the use of immunohistochemistry services, which we are implementing in a few of our hospitals, especially. We have a pilot project already at the National Hospital here in Abuja, and using this kind of approach, we are able to pinpoint and able also to predict better what is likely to be the outcome when and which kind of drugs will be most effective in each individual patient. However, the emphasis of Nigeria is mainly on how to ensure that we reduce the burden of cancer in our society. And for us to be able to reduce the burden of cancer in our society, it means we must put a lot of priority attention on prevention. And that is why we have introduced routine immunization for hepatitis B into our national immunization program, because immunization for hepatitis B can help us prevent lung cancers. We have also introduced routine immunization, not routine yet, but we are putting in place immunization of girls, young girls, against HPV, human papillomavirus, which is the causative organism for cervical cancer. You must know that cervical cancer is the second most common cancer in Nigeria. Beyond that, we're increasing our advocacy. We're also targeting screening services. Screening services will help us to detect cancers or changes early at precancerous stage, or even if it's going to be at cancerous stage, at the very early stages of the cancer when it is still treatable and curable. So the emphasis of Nigeria beyond precision medicine, targeted medicine, is to reduce the burden of cancer in our society through the use of prevention at primary and secondary levels.
All right, in reducing the prevalence of cancer in Nigeria, how accessible and affordable are the treatments?
Well, generally speaking, cancer treatment is expensive, but what government has tried to do is to create intervention programs and also create a sustainable, robust system that can support people who have cancer in their lives. As an example, you know that we have introduced the Cancer Health Fund, and the Cancer Health Fund is able to help patients who are diagnosed of some specific cancers to be able to access some sort of support from government, to be able to access care, access diagnostic measures, and to also access monitoring measures. Beyond that, government has also introduced a more sustainable method through the Catastrophic Health Fund, using the instrumentality of the National health insurance agency so that cancer can become an insured ailment in our country, and people who have cancers can have access to some sort of cancer, some sort of insurance, health insurance, to support the treatment, the diagnosis, the monitoring of cancer. So through these models, we have been able to at least reduce the burden in terms of financing on cancer patients in our country. And of course, I must say that in 2025, there's already a plan to increase the amount of fund that is available within the Cancer Health Fund, and also to expand the scope of the fund through increasing facilities where they are available and the kind of cancers that we can use the fund to treat.